Hi, welcome to CES 2015 at the WebMD Lounge. Really excited to have with us today the team from Tellspec, which has got a really incredible platform which may transform the way that you eat and diet in the future. So we're joined by Isabell Hoffmann, their CEO, Ned and Gail from their team. And first of all, welcome Isabell.
Thank you, Daniel.
Tell us a little bit about yourself, your background, and how Tellspec got started.
Well, I'm a serial entrepreneur. This is my 8th company. So Tellspec got started because my daughter fell sick when we moved from Europe to North America. And she had severe allergies to penicillin and to gluten. And I wanted to be able to help someone like her. I visit many hospitals and I saw many patients with the same symptoms. And I figured, what about having something that you could carry with you and could go safely to a restaurant and eat and not react?
So the idea here is when you have a plate of food in front of you, maybe it's an unknown food, what's in it? What's its caloric content? Does it have gluten? Does it have peanuts? Tell us about where the technology started and where it is today.
So the first idea was, how do you develop something like that? And I thought, from my studies in astrophysics, I'm not an astrophysicist, but I took a lot of courses in astrophysics. I thought the spectrometer makes a lot of sense. And the next thing was, are there spectrometers that are small enough to do this? And the next thing is, what type of spectroscopy are we talking about? So this is 2.5 years ago. And then, can the chemometric algorithms that are used in spectroscopy be adapted to identify food ingredients in foods? Today we have a working scanner, working prototype scanner that scans foods, caloric, carbohydrates, proteins and fats, as well as ingredients. We're able to estimate sugars, not just simple sugar like a sucrose, but maltose, glucose, fructose. We're able to do very well gluten, non-gluten, and all sorts of other allergens like eggs and milk. And we're building our database. We use machine learning, so we are very dependent on the database.
So you'll scan lots of foods, learn how much gluten is in there, tune it, and improve your algorithm and your technology. So you're here with Ned. Ned's got the actual prototype. Maybe you can show it to us, describe it a little bit, and we'll see it in action. This is the Tellspec product.
Okay, so this is our first beta prototypes. What they are, they're near-infrared spectrometers. They're also Bluetooth enabled, and they're paired with the phones. So what we have here is some selection of foods, and we'll let you pick from the selection
well,
of
I'm
foods.
I'm a doctor, so an apple a day. We'll keep the doctor away. We'll start with the apple. All right.
Okay. So let's do a scan of an apple. Okay, somebody needs to hold the mic. Okay.
Lift them up high. Here we go.
Oh, the scanner. Yeah. Okay. So here we go. Those are the results of the previous scan. Now you may want to turn it that way. I'm performing the scan now. Hopefully you see the lights there. And the results should be changing. I can't see from here. If our Wi-Fi is good, we've had some problems with the cloud.
There you go.
Ah, there it is. Okay. It's a bit slow today, but we just scanned an apple. We have a classification algorithm in place that's able also to detect some types of foods. So we're displaying calories, carbs, proteins on the scan of the apple.
So let's try something maybe a little less healthy.
I like this one because it goes through the packaging. So I'll take a scan of this one going through the packaging as long as it's translucent. Okay, so there's a scan, and the results should be showing.
So this is really a 5-second scan or less, communicated right to your platform.
Our latency is actually 3 seconds, but sometimes due to network congestion.
Right. So I actually can see here the number of calories, the type of foods in there that it has gluten, eggs, milk, total sugar, fructose components.
Yeah, and there is more than that, because if a person has scanned the food and they don't know the ingredient, you can actually click on the ingredient and you have access to Telspecopedia, which is a Wikipedia of food and health. connections. So you can understand what that food potentially can be beneficial or non-beneficial to your health.
Right. So someone who's trying to tune a certain type of diet, has a sort of food allergy, is trying to know what they're ingesting, whether organic, pesticides, glutens, peanuts, all that will be possible in terms of a very quick, rapid point-of-care scan.
Not pesticides, not trace elements. For trace elements, we need longer integration scans, longer time, and we need a wider range. But this is down the pipe. Our vision will be to have pesticides, byproducts, heavy metals, ability to do that, but not in the first version of the scanner.
Sure. So, this technology will probably integrate with what kind of users? Where do you see sort of the first user for this in terms of the market?
Likely the pre-diabetic, diabetic, and people that want to control their weight because of the epidemic that we live today in the world. But I think this technology is important globally for everyone that wants to stay healthy and needs to avoid certain foods or is traveling to places in the world where the food is very, very contaminated. So food safety is a huge importance for this technology.
Right. And from the technological perspective, where do you see this heading next? Smaller, more integrated?
Yes, exactly. So we're currently working on the miniaturization of the scanner. We're hoping to develop a smaller size, more portable, and at the same time, we're constantly improving our algorithms. It's a big data project, so the more data we have, the more accurate we are.
Right.
And another aspect is also the applications, which is the mobile apps that we have. We're also working on that to add additional features for the users.
Right. So this is really a food tricorder in a sense, right?
Yes.
Pretty magical.
This is what we call a Google Food or a Google Wiki Food, which is a bit corny, but because it is informing and educating the user, at the same time allowing the user to scan their food, improve their health. After all, the food is that missing piece, that missing link on this digital health.
And this actually takes you kind of beyond the label, right? It's not just the pure ingredients. What do you mean when you think about beyond the label?
Well, for instance, the label often just says sugar, and we actually estimate the sugars. We actually give, fructose, glucose, maltose, the contents of the actual sugar. If you are diabetic or pre-diabetic, you definitely do not want to eat fructose. And the way we do that is because we train our algorithms with analytically, chemically tested foods. We don't use labels.
Got it. So you're an entrepreneur. This is a kind of a different kind of space. What have you learned? And you've done interesting crowdfunding for this as well. Give us a little arc of the company trajectory and where you'd like to be in the next couple of years.
In terms of the company, we'd like to be with a device in every single country and helping people choose and be more informed about what they eat. Globally, this is a global project and one that would benefit humanity.
Sure.
Yeah.
And Alice, maybe Gail, where would you see this going? Might this be a Tellspec attachment to your smartphone or in your purse? Where's this going to be in terms of the form factor?
Sure. In terms of form factor, we've had several opportunities to look at actually a handheld, where it could actually sit in a pocket. The form factor is very appealing to many medical providers because they can use that as an intermediary. Also, very similar to the live core philosophy now, where it can actually attach to the back of the phone and it has an independent scanner that can be detached and carry it forward.
Terrific. So we're seeing some really interesting technology here from Tellspec. It's essentially a medical or a food tricorder. And give us, for those folks who are going to want to buy this for medical or health applications, when might this be coming to market?
So the medical application is not going to be the first one because to have a good accuracy, we need a lot of scans. So we predict that within 3 to 5 years, we will be doing a medical device. Right now, it's a consumer device. We are introducing this device to our pre-orders that we did in the crowdfunding within Q2 of this year, and we hope to be in the retail stores for Christmas this year.
Fantastic. Well, thank you, Isabell and team. Tellspec, really amazing technology, and I think it's going to be a game changer in terms of how we eat, do food safety, and beyond. So Daniel Kraft signing off from CES 2015 here at the WebMD booth, and thanks for joining us.
Thank you.